you experience recurrent low back pain despite doing regular exercises, eating well, maintaining healthy weight, and watching your posture at all times? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you the relationship between scoliosis and low back pain. So here at My Favourite Physio, we see lots of people who come in experiencing low back pain. A common complaint would be that they find they have recurrent low back pain despite trying to do regular exercises, watching their diet to maintain healthy weight, and watching their posture at all times. Now, often when we see someone who comes in experiencing low back pain, we would have a look at their whole spine and assess if they have scoliosis. And scoliosis means that you would have a curvature in your spine left to right, and often it's mild and people don't realize they have it. If we suspect scoliosis is happening in your spine, we would send you off for a full spine x-ray to determine how much curvature there is in your spine. Now, generally, most people don't realize they have 10 to 15 degrees of curvature in their spine coming from their neck all the way down to the lower back. Unless you have 25 degrees of bend in your spine, most people don't realize it, and it is not treated as a child. So by now, these young adults in their 20s, 30s, and as you get older at 40, 50, 60, they don't realize that mild curvature in their spine. What they do experience is recurrent back pain. So having a mild scoliosis in your back can often result in the three following events. The first is recurrent back pain despite what you do. So you can exercise and keep fit and well, which is really important and helpful. However, you might still find you do get recurrent back pain. That's because your spine's not straight, so the pull of the muscles is imbalanced on left and right because the spine is curved slightly. Most of the time, people will find that they get back pain worse on active days. To treat that, you probably actually need an expert physiotherapist to have a feel of those muscles and treat the muscles that are too tight and release those muscle imbalances that you find through your back. The second common event happens because of scoliosis in your back is you might find you have referred pain in your hip or pain in your neck and shoulders and upper back. The reason again is because your spine's slightly curved. You'll be walking slightly imbalanced with a little bit more tilt in your pelvis. That results in hip pain that can go down your leg and buttock area. Up on top as well, if the curvature is more higher, you'll find that you get neck and shoulder pain with just driving, working at a computer. There's always this imbalance. And so again, to treat that, you'll find that you need some regular physiotherapy to release the muscle imbalance in your hips and in your neck and shoulder area. The third event that happens because of mild scoliosis in your back is, unfortunately, you find that the frequency of back pain or hip pain or upper back and shoulder pain increases with age. So as we get older, just due to wear and tear, you might find that mild scoliosis that didn't seem to affect you in your 20s or 30s is now affecting you in your 50s and 60s. So again, the key is to maintain your well-being by having a regular physio treatment to release those muscles to keep you pain-free and active. So if you are experiencing recurrent back pain and you just don't understand why, perhaps you actually have a mild scoliosis in your spine. To figure out if you do and how to manage your recurrent low back pain, what you need to do is to speak to an expert physiotherapist. If you would like to speak to one of our expert physiotherapists here at My Favourite Physio, the number to ring is 02-9790-4233. And if you know somebody out there in your world who experiences recurrent low back pain or hip pain or neck and shoulder pain, despite doing their exercises, despite doing everything they can to keep well and healthy and fit, why don't you like and share this video with them? Until next time, have a lovely day. Bye.